Good evening, everybody, and thank you for joining us on another webinar on the SML series, Smilefast, A Straighter Smile in Just 6 Months. Tonight's presenter is Dr. Jeffrey Hall, specialist orthodontist. He has been a practitioner for over 28 years and has completed over 10,000 clinical cases. He is a founding member of the Australian Lingual Orthodontic Association, a member of the Australian Society of Orthodontists, and a member of the American Society of Orthodontists. And tonight's webinar is going to be great. Without further ado, Dr. Jeffrey Hall.
Thank you very much for the kind introduction. It's a pleasure to speak to everybody here. I'm in Melbourne, Australia, and talking to you live in the United States. So tonight I want to present on Smilefast, or more importantly, on comprehensive orthodontic training in short-term orthodontics. And what we're going to be talking about tonight is our technique, Smilefast, which we believe is precise, predictable orthodontics. And what we want to be talking about is comprehensive orthodontic training in this area of short-term orthodontics. Something which I think is missed out in a lot of other systems where they don't teach you enough of the principles in orthodontics. And that's what we want to talk about tonight. So who am I? I've had a very kind introduction, but I've been in orthodontics for 28 years. I did my orthodontic training at the University of Pennsylvania, so everybody would know the University of Penn. So I trained over there back in 1990. I came top of my class, and I don't say that out of any arrogance, because I probably came bottom of my class as an undergraduate in dentistry. And the point that I'm trying to make is anybody can do orthodontics. It is actually quite straightforward. And what happens is orthodontists have kept this as very much a closed shop and haven't taught you the basics, because it is really quite straightforward. And I'm going to prove that to you tonight. I was the first practitioner to bring Invisalign outside of the United States, and I've been a founding member of the Seattle Study Club here in Australia and other study clubs. So I have a great passion in teaching general practitioners orthodontics. So tonight's webinar, I want to focus on a few questions. What is Smilefast? Why do you need Smilefast in your practice? What are the benefits of Smilefast to your patients and to your practice? And why should you choose Smilefast as your method of choice for the short-term orthodontic market? And at the end of the webinar, we'll talk about how to obtain discounts for the courses that we're going to be doing and answer any questions that you might have. So what is Smilefast? Well, we believe it's the most efficient and predictable cosmetic orthodontic solution, because what it does, it provides patients with a significant improvement in their dental alignment in a short period of time. It's precise, it's predictable, and it's easy. And why? Because Smilefast allows for a cosmetic correction of the front teeth without occlusal damage. Our goal with Smilefast is not skeletal or occlusal perfection, but what we want to do is give our patients a great natural smile in a short period of time. And what it means, it's faster and therefore more affordable. And what that means to you and your patients is more patients in your practice and more happier patients as well. Because what do they want? They want fast and predictable solutions. So why do you need Smilefast in your practice? Because you're going to give patients what they want. And we all know patients want straight teeth and a beautiful smile. It's not very often a patient will come into your practice and say, "Doctor, please give me a root canal treatment on my upper right central incisor." They'll come in and say, "Doctor, I want to have straight teeth. I want to look better. I want to have a much nicer, whiter smile." That's what they want, and that's why they're coming to see you. The days have changed, as I'm sure you're aware, in clinical dentistry, that we have to give patients what they want if we want to stay busy in our profession. And not only to stay busy, but enjoy what we do, which is this area of cosmetic dentistry. We all know every patient needs healthy functioning teeth. And our job as a dentist is to provide patients with healthy functioning teeth. But what they really want is straight teeth and a beautiful smile. And Smilefast meets this demand and builds your practice. There is nothing that's going to build your practice more than providing patients with straight and white teeth in a short period of time. I can assure you of that. And why would you offer Smilefast? Because it's a technique that in 6 to 9 months you can provide patients with a significantly improved smile. It's a technique, procedure that patients want. And when somebody wants something, they will always find a way to pay for it. I'm sure you've had patients in your practice, like I have, where they've claimed they can't afford treatment, but they've cancelled their appointments because they're going overseas for a holiday. Or they come in with the latest iPhone that they just purchased for $1,000. In other words, patients will always find a way to pay for what they want. You have to just provide them with the service that they really want. And we all know what they want is straight and white teeth. And this is dramatically going to increase your new patient flow. Obviously, your orthodontic starts. And as a byproduct of that, your general dental procedures, your crown and bridges, your veneers, your whitening, etc. And at the end of the day, it's going to drive more cosmetically oriented patients into your practice. And it can really build your business on a number of fronts. From the point of view of firstly differentiating your practice from your competitors, but you can reduce and delegate the unprofitable procedures like the cleanings, etc., because you're going to be busier doing the orthodontics. But one of the great advantages of orthodontics in your practice, and especially Smilefast, is you can delegate 95% of these procedures to your auxiliaries. So if you're in a state where auxiliaries are allowed to do some work, you can delegate this, and we can train those auxiliaries to do those procedures, which means it becomes very efficient. It will really increase your hourly profitability and really increase your gross and net income. And at the end of the day, it offers a new area in your dental practice where you can achieve greater dental satisfaction. It's a treatment patients want and the benefits you're looking for. It's a complete system from the first contact, the new patient exam, or even from the first phone call of the patient to fee presentation, all the way through putting the brackets on, the monthly adjustment visits, and finally the removal of the braces and the retention phase of therapy. Where it stands today, Smilefast is purely designed for the adult market and primarily for cosmetic treatment. And the reason being is we're not here to change occlusal schemes. We're here to improve the alignment of their existing teeth. So once again, if that was a child, if that was my child who was 12 years old, I would want a perfect class 1 mutually protected occlusion. And therefore that's outside the realm of Smilefast, which at this stage is designed for purely cosmetic alignment. And I would argue that aligner therapy is also the same. It's only good for cosmetic alignment. It's not ideal for getting perfect occlusions. So at this stage, Smilefast is designed for adult cosmetic alignment in a short period of time and very predictably performed. And you're going to say to me, Jeff, that's great, you're an orthodontist. So I'm going to show you cases that have been completed by our Smilefast doctors who have had no previous orthodontic experience. They've come to a 2-day course, and straight after that course, they're ready to go ahead and do orthodontic cases. So let's have a look at some of those cases that they've done. So here we are, initially with some crowded teeth, protrusive incisors, deep overbite, and the final treatment done in 7 months with bonded retainers, from a doctor who had never put a brace on, who had never done orthodontic treatment before. So 7 months of treatment before and after. That's pretty impressive. But Virginia did a case, spacing of both the upper and lowers, 6 months of treatment. Here we are, 7 months of treatment with a very deep bite, significant crowding, significant irregularity of the upper anteriors, significant gingival margin height discrepancies done in 7 months with our Smilefast approach. And the key, as we're going to be talking about later, is one of the advantages of Smilefast is we have a digital indirect bonding solution. So the brackets are placed on in the best, nearly perfect position. And it's done in the digital world, similar to an Invisalign ClinCheck that you're all familiar with. So this is the key to having predictable orthodontic therapy, is having a good digital indirect bonding setup, and finally the bracket placement that mimics exactly that digital indirect bonding. So that's what we use with our Smilefast approach. So here we are with even a mold class 3 tendency, treated in 8 months and was done with a lower incisor extraction. Here we are with another patient of a different doctor. So initially we've got some spacing of the uppers and lowers, a deep overbite, and finished in 6 months. And the patients are ecstatic. The doctors are ecstatic. The hourly rate is exceptional. Here we are with a bit of overjet, some mold spacing. The patient did not like the diastema between the upper central incisors. Once again, we've done a digital indirect bonding setup. We can mimic exactly how the teeth are going to move with the brackets and wires in place. And it shows the before and after of the proposed digital setup with the brackets on. And on the right-hand side of the screen, it shows the final result. Significant improvement done in 7 months. All of those cases were treated by general dentists with no orthodontic experience at all. And we've got severe crowding of the upper and lower teeth, some protrusion of the upper incisors. Once again, always done with a digital indirect bonding technique, digital indirect bonding bracket placement, followed by the digital indirect bonding. And here we are at the D band, and I think if I remember correctly, that was 8 months of treatment. Sorry, I tell a lie, that was 7 months of treatment. Great results, very quickly, very efficiently, and very profitably. And we'll talk about treatment time in a minute. And I think this is the last case to show you from that point of view, severe crowding of the upper anteriors. And I ask you, even if you did no orthodontics and you wanted to do this through veneers, how could you do this? You really can't. You would cut back that upper right central to the point of exposing the pulp. So in fact, what we're saying to you here is you need to have orthodontics as part of your armamentarium, even to practice good cosmetic restorative dentistry, as far as I'm concerned. So here we are, 6 months in treatment with a significant improvement. And even if that patient wanted to have some final cosmetic work done, you could do that with minimal preparation. So you could do that with a conservative approach. So 6 months in treatment, and any dentist can do this after they've done the course. So what's the competitive advantage of the Smilefast compared to aligners? Because everybody knows about aligners, and there's no doubt when you look at the per hour profit of fixed braces of Smilefast compared to aligners, it doesn't even compare. The lab fee for aligners is so much higher, but the problem with aligner treatment is the fact that it's very unpredictable. The movements are very unpredictable. In other words, the extrusion of teeth is unpredictable. The severe rotations of curved teeth, such as canines and premolars, is unpredictable with aligner treatment. There's no doubt you can use veneers. Veneers is a great option. It has been for many, many years, but it's a very destructive option. And I think we all as dentists would like to use a conservative, non-destructive approach. If that was my patient, if that was my mother, I would want it to be done without significant tooth reduction. And I'm sure everybody in the audience would feel the same way. Hence, aligning the teeth with a short-term orthodontic approach in preparation to any cosmetic work is obviously significantly advantageous to the patient and also to the doctor, because it's going to mean a much more simple case from a restorative point of view. So, there are concerns with other types of cosmetic treatment. aligners, and I'm sure anybody with experience in aligners, and I've been doing it for 15, 18, 20 years now with the aligners take a long time in treatment. There are lots of visits. It's very expensive normally, and the movements can be very unpredictable. Veneers are invasive, they're costly. Then you've got your traditional braces treatment, which normally lack digital accuracy, and the patients are also too long in treatment. And then you've got bonded composite, which is a low end, it's not natural, not permanent, it just colours, etc., etc. What's interesting is adults have barriers to treatment. And most of the barriers are time, cost, and appearance. And then throw in extractions and orthodontic surgery, and most adults don't want to undergo orthodontic treatment. And most people are sitting out there going, oh, they don't want braces on their teeth. Well, that's not actually true. So we did a survey in our practice of 500 adult patients who accepted orthodontic treatment. So I can't tell you what the patients who didn't accept any treatment, but these are 500 adults who accepted orthodontic treatment. And I offered them all three options. I offered them the ideal treatment, whether it be 2 years of braces, extractions, orthodontic surgery, whatever is their ideal. I offered them Smilefast if they're a candidate for that, and I also offered them Invisalign as well. 90% of the 500 patients who chose treatment chose Smilefast. 5% chose aligner treatment, and 5% chose the ideal. And every time we asked the question, why, they said time was the biggest factor. If we can do this under 12 months, 9 months, even 6 months, they're more likely to undergo the Smilefast therapy. They don't mind wearing the clear braces with clear arch wires or tooth-coloured arch wires for 6 to 9 months. They don't want to wear it for 2 years. So there's this psychological barrier of less than 12 months. So we've proven that in our own research, in our own practice. As far as I'm concerned, you must be offering cosmetic orthodontics today. If you want to be competitive in today's market, you've got no choice. So when we look at orthodontics in general, what are the keys to doing orthodontic treatment? The first is diagnosis, which is which cases to treat and which not to treat. If we can keep you in treating only those cases which are easy, then it's easy for you. Once we've decided which cases to treat, then we've got to learn how to put the brackets on. And we use the digital software, which will also make it absolutely simple for you to place orthodontic brackets. And then once we've done that, we have to just teach you some basic mechanics of changing arch wires, using power change. All that stuff we can teach you in 2 days. And you've learnt the 3 keys to orthodontic therapy. Diagnosis, as in which cases to treat and which not to, and why, the positioning of the braces, and the mechanics. And there's this 80-20 rule. I believe in the 80-20 rule in life in general. You can treat 80% of the patients very easily. It's knowing which 20% not to treat. And that's where we have to give you the comprehensive orthodontic training so you can identify those 80% that are easy to treat and identify the 20% which aren't. Having said that, we also have our online portal. So every time that you put a case on, we will approve or reject that case. So we're not going to let you do any of these cases which are in that 20% category, because we want your life to be nice and easy. So we've got a double check method to make sure that every case that you do will be simple, predictable, and will give you a great result in a short period of time. But we'll back that up with our comprehensive training. So this gives you an example of a digital setup where we see the brackets on in the mal-occluded position. We see what the teeth are going to look like in the final result. And prior to accepting that case, you can do adjustments. You can ask our technicians to change the position of brackets, to alter the position of teeth. And we will do all that for you prior to you accepting it. So exactly similar to a clean check that you would see with aligned therapy. So the brackets are placed in the mal-occluded position, and this bracket positioning or the final outcome is dictated by the bracket wire interface. There is no other software out there that will drive the teeth into the correct position based on the bracket wire interface. And that's where this is very unique software. So, and we're going to show you very quickly later on our 3D viewer that you can see exactly what we're talking about. So I'm going to show you some cases that can routinely be treated after a 2-day Smilefast course. So you can see 3 different cases on the screen here. On the left, 6 months of treatment. In the middle, 9 months of treatment. Deep bite, some moderate crowding, and 7 months of treatment on the right-hand side of your screen with some mold spacing on the upper arch and a little bit of an open bite. So some more cases, 8 months of treatment, 6 months of treatment, 7 months of treatment. And I ask you, if these patients walked into your practice and they said to you, "Doctor, can I have a cosmetic correction to my smile?" how could you do this without considering some form of orthodontic intervention, even as a preliminary to restorative therapy? So here we are, 6 months where we've corrected the deep overbite, the rotation of the upper right lateral. We've given that patient a significantly improved smile in a really short period of time. Even to the extent of uneven gingival margins, where teeth have over-erupted due to wear. So here we are, where we can align the teeth even in preparation for a veneer, just doing even one arch treatment. So the upper left central incisor, we've actually purposely inset that a little bit palatally so that there would be no reduction required on the labial aspect in preparation for the veneer. What about this case here? How do you resolve the crowding in that lower arch? How do you do veneers on the lower anterior teeth? And there's also this great fallacy out there that people are only worried about their upper teeth, because as we get older, we start to show more of the lower teeth. So in our practice, we're seeing a lot of adults in their 50s and their 60s coming to see us because now they're worried about the appearance of their lower teeth, not the upper teeth. So a patient like that with this rotated and distally inclined lower right lateral incisor would be really concerned as they get older to the appearance of that tooth. So in 8 months of treatment, we've significantly improved that. And we're within that less than 12-month time frame, which is the normal psychological barrier to patients. Severe lower crowding, treated in 7 months. This is a severe case of crowding of the upper and lower teeth, 10 months to get a significant improvement. Is it perfection? No. Is it a significant improvement? Absolutely. Was the patient ecstatic? Absolutely. Did the patient refer 10 other patients within 3 months? Absolutely. This is one of the greatest practice builders you're going to have. I'm sure patients don't refer you many patients once again because you've done a root canal therapy on an upper right first premolar tooth. They're going to refer your patients because you've given them an improvement in their appearance and an improvement in their self-confidence. The benefits of Smilefast to your practice. Profit is not a dirty word. Everybody talks about profit and they get scared about it, but it is actually, you cannot be in business today without making a profit. That's the whole idea. And Smilefast is extremely profitable. In the next webinar that we're going to present with Space Maintainer Laboratories, we're going to discuss that more fully. But suffice to say, at this particular time, it's exceptionally profitable if you're doing it yourself, and even more profitable if we can delegate it to our auxiliaries. So you've got to remember, short-term cosmetic orthodontics, it's not a replacement for comprehensive orthodontics. We still have to provide the patients with the ideal option. But I can tell you now, adults do not want that. They want a significant improvement in their appearance in a short period of time. And one of the things that we will be talking about as a mantra in the courses that I'm going to be giving later on is we want to pick the low-lying fruit. You want to do the easy cases. Okay? That's where the money is, that's where the fun is, that's where the excitement is for you guys, okay? Orthodontists really want to pick the low-lying fruit as well, I might add, but they have to get every case. So remember, Smilefast is designed for adults, not for children. And if we're not sure, you can refer them out or ask for advice. And that's what we're here for in Smilefast, is to help you with advice. So let's just show you a very quick case report. So this lady comes in, she's got a Class 2 Division 1 malocclusion, slightly retrognatic mandible. She's got a Class 2 buccal relationship, deep overbite, minimal overjet because her upper incisors are retrusive. She went to 4 orthodontists in my area. 3 of them said she needs jaw surgery. 1 said she needs to have extractions of upper first premolars. She came to see me, and there's nothing wrong with those options that were given to her. But I said, you know what, you've got another option. Let's just straighten up your teeth. And she goes, fantastic, I don't want jaw surgery, I don't want extractions. I'm sure you've heard all this before. So we look at that, we do a step analysis, which is a very simple analysis that we can do for you. We have our 3D viewer where we can see exactly what it's going to look like before and after, and we can show the patient if we want to as well. So we can see the before with the brackets on, we can see the after with the alignment of the teeth. And we have, as we're going to teach you in the course, a specific criteria that we look for in diagnosis. So every case is diagnosed by looking at this criteria. What is the sagittal class? What's the skeletal vertical? The upper and lower incisor position, the crowding, the spacing. So we go through this in detail on each and every case so nothing's missed out. Once we do the diagnosis, we then look at a treatment plan. And this makes no sense to anybody today, but we look at that for each patient, and I can guarantee you, after the 2-day course, this is going to be so boring to you because you're going to understand this so well. But suffice to say, we have a very regimented approach from a diagnosis and from a treatment plan point of view. So we put the indirect bonding trays in. So these are basically like mouthguard trays with brackets in place. So if you dentists out there can etch the teeth and bond the teeth and can hold a mouthguard tray, you can do indirect bonding. That's how easy it is. And in my practice, I allow about 1.5 minutes to hold the upper tray, 1.5 minutes to hold the lower tray. So in my practice, I have 3 minutes of chair-side time to put up and lower braces on. The rest of it is all delegated out. So you can imagine how profitable that can be in a general dental practice. So we put the trays in, we go ahead and cure them, we take the trays off, the brackets are now glued onto the tooth, voila. We put the first wire in. So this was in January 2013. And I won't go into the technicalities because that's what we teach in the course, but let's look at it month by month. So here we are in February, we've just changed the wires, which we train you in the course to do. Here we are 2 months in treatment. Look at the improvement in the alignment of the teeth in 2 months. 3 months in treatment, we've changed the wires again. That's all we've done. It's a 10-minute appointment to change the wires. 4 months in treatment, we've changed the lower wire. Normally we just retie the wires as well, but sometimes we change the wires, but we teach that all in the course. Here we are 5 months in treatment, the teeth are straight. And what you're going to find in the majority of patients is that after 3 months of treatment, if you ask the patient, would you have had orthodontic treatment if your teeth looked like this at the time of initial presentation? They will all say to you, no, I wouldn't have. That just shows you within 3 months how powerful it is, just some braces and some nitinol wires. So here we are. Look at the difference in the smile. 6 months in treatment. Yes, she's got some overjet, but her teeth look straight. And most patients don't worry about overjet, provided the teeth aren't flared forwards. If the teeth are in the right position, the right angulation, they don't mind about overjet. They just want their teeth to look straighter. Remember, this patient went to 4 other orthodontists, 3 said orthodontic surgery, 1 said extractions of upper teeth. We've done this non-extraction in 6 months. she's delighted. A significant improvement in her smile, significant improvement in her arch form, etc., etc. Anybody can do this. Anyone out there can achieve these results after a 2-day training course and with our systems and obviously our support. So, is Smilefast superior to other systems? Well, we believe it is, because one of the indirect bonding techniques that we use, it's a digital process. We provide you with support by an orthodontist and an orthodontic team. We make sure that your scope of treatment is within the realms of being easy. The training is by us as orthodontists. And Smilefast is out there doing new innovations all the time, which we're going to show you. So, we believe that whoever's going to teach you orthodontics should be a specialist teaching sound orthodontic principles. There should be support by qualified practitioners, not by a forum that you email to and it's a blind leading the blind, you don't know who's giving you advice. And you've got to have a good lab involved with good lab doctor-patient communication. And to submit cases should be easy. But one of the things that I believe should be done by whoever is supporting you is to allow you to treat the appropriate cases and tell you not to treat the inappropriate cases. And we do this through our Smilefast portal, where we'll approve cases, obviously if they're the correct cases, but we will also reject cases, but we do so to protect you. So you don't do any cases which are above your level of competency, and more importantly, that you won't be able to get the good result in that period of time, because at the end of the day, we want you to be profitable with happy patients. So, you need a provider that's going to give you ongoing learning and case support. And we do that through our portal, visit by visit if you want. That's all included. So visit by visit, you can load up the photographs, you can ask us questions, and we can provide you with case support, visit by visit for that patient. So you can always feel fully comfortable we are there holding your hand. So, let's just show you. So this is our viewer. So this is our 3D viewer, and we can go and we can look at it in all different views. We can show on one side of the screen the post-treatment. So if you look at this, we've got the pre-treatment on the left side, the post-treatment on the right side. I can take off the arch wire. I can take off the brackets if I want to. I can put the brackets back on. So I can look at it in any view I want. And at this particular point, I can actually ask the technician to change the position of the brackets to get this tooth in a different position, etc. And before I'm happy with it, I can review it. And once I'm happy with the setup, I can then go ahead and approve it. And the technology that we have is really, we haven't got enough time to go through it now, but this is a case where we've actually taken out a lower incisor. So let me just show you where we take out the lower incisor, and we can actually show as a video how the teeth are going to move, and we can show that to the patient as well. And we can actually send them a video of that, etc. So there's a lot of other technology in here. We can show the collisions, we can show the tooth symmetry, we've got occlusograms, but suffice to say you've got a 3D viewer which will show the before and after. So let's just continue with the slideshow. Okay, so the digital indirect bonding setup is it's a web-based 3D viewer. There's no costs involved to buy the viewer. That's all just on the web, and we give you your own username and password, so you're protected from anybody else being able to see it. Indirect bonding is absolutely key to being able to place brackets on in a predictable, easy, and efficient process. But to me, indirect bonding with a digital setup is the key, not a manual setup. You can't have a technician putting brackets on that you don't know where they are. you've got to be sure of what the final result's going to be. So basically, you have an indirect bonding tray with the brackets already in place, with a composite base already on those brackets, and all you're going to do is cement that tray into the patient's mouth and then peel off the tray, and the brackets will remain on the teeth. So if you can bond, etch and bond, you can do indirect bonding. So our competitors out there, I'm sure you've seen them all before, they use a manual indirect bonding system. Yeah, that's like me saying to you, I'm going to sell you a crown, and I'm going to sell you the crown for $50. But I'm not going to give you that crown on a model or in the digital world. I'm just going to put it into a plastic bag for you. Would you take that? So when the patient comes in, you're going to try it in, and you don't know if it's going to fit or not. I wouldn't, and I'm sure most of you wouldn't either. That's the same with manual indirect bonding. You've got a technician putting the brackets on a model. You have no idea where those brackets are. You don't know which technician put them on. It could have been somebody that's just come off the street. So I believe totally in a digital indirect bonding system, and I think anything else is wrong. So what makes us unique and superior? Well, I think our training that I've talked about, we have our online web-based portal, we have a unique digital indirect bonding system, and we're innovative, as I'm going to talk about later on. When you want to evaluate other systems, you've really got to look at all different things that they do. Do they use intra and extraoral photographs? Do they use cephalometrics to confirm their diagnosis? A system that has a non-orthodontist determining if the case is suitable. See, I don't think that's right. A system where ongoing support is provided by other dentists with minimal experience. I don't think that's right. A system that uses a technician or a layperson to place the brackets with no idea of the eventual outcome. I don't think that's right. What we offer is a system by a specialist orthodontist, our online portal. We can do one-on-one support as required, a precise bracket placement technique using indirect bonding, and comprehensive training in this area of short-term orthodontics. And I know that America is very litigious. At the end of the day, if something happened to you, who would you want to defend you? A general dentist or a specialist US trained orthodontist? At the end of the day, that's your decision, okay? Smilefast provides what I believe a total support system for the doctor, case by case, with the ability to download photos at each visit, ask any questions about the case, and they will be answered by fully trained practitioners and fully overseen by our group of specialist orthodontists, ensuring doctors will learn very quickly and their skill level will be accelerated. There's no software to be purchased. And at the end of the day, what we want is a system that will provide consistent quality outcomes with minimal treatment times, minimal doctor chairside time, maximum profitability, and most importantly, no stress and totally happy patients. It's your choice. So what do other people say about us? Obviously, we don't have dentists at the moment in America. We will have. But from the beginning of treatment till the end, the Smilefast team made every step so stress-free. Digital indirect bonding and 3D virtual setup, online case management, and continual education, it can't get any better than this. I've done a few short-term orthodontic courses. Smilefast is the best system without any questions. I just wanted to say what a fantastic system Smilefast is. You guys have been amazing in responding to questions. And Smilefast is a must-do for any dentist that wants to provide high-quality cosmetic dentistry to the patients. Our ongoing support provided by Smilefast is invaluable, with most clinical questions answered within the day, giving you confidence in treating your patients because you know that backing is only an email or phone call away. And this will be no different to whether you're in Melbourne, Sydney, Los Angeles, or Philadelphia. It'll be exactly, with the internet, it'll be the same response time. This was a young dentist. The training that Smilefast course provides is excellent. Jeff goes into great detail to get you to understand the theory of which cases are suitable and which are not. I tried a few different short-term orthodontic courses, but found them just selling a system. Jeff really goes to great length to get you to understand the fundamentals when approaching cases. So remember the 80-20 rule. So in Smilefast, we're going to finish up in a few minutes. We have a Smilefast Pro with hands-on training, which is a 2-day course. Down the track, we've even got an advanced course. So when we do the Smilefast Pro 2-day course, we provide you with 9 hours of pre-course training videos. So we want to go through all about basics of occlusion, get you up to a level so that we get the most out of the 2-day face-to-face course. So this gives you an idea of what you will learn just in the pre-course training videos. Then when we do the 2-day face-to-face course, we're going to go through the correct diagnosis for the different types of cases, the key treatment steps, in-depth orthodontic training on brackets, archwise, tooth movement, digital indirect bonding, bracket placement, management of crowding, etc., etc. Okay? You'll learn so much in 2 days, more than you've learned in your entire dental training in orthodontics, that's for sure. And we're going to supply in this 2-day course the 9 hours of online course material, all the lecture slides printed up, hard copies of written materials, brochures, quick reference guide, a before and after album. You get access to the online portal, you get access to marketing material in your practice, and everything that's required for the hands-on course. Now, at the moment, we're just planning the course in December, but I can tell you that the extra value of what you're going to receive at the course is probably about $2,500. Okay, but Space Maintainers Laboratory will tell you more about the intended date of the course, which at this stage we're looking at in early December. And then there's also an advanced course. So once you've completed a few cases, we really suggest that you do the advanced course to take you to the next level. And that's a 2-day course. But I said to you before that Smilefast is a very innovative company. So we're looking at quite a few things at the moment. One, we're looking at self-ligation clear brackets to make it even easier for our clients and more predictable and less patient visits. To give you an idea of some trials that we're doing, 6 months of treatment from before and after with the clear self-ligation bracket. We're not ready yet, but that's what we're trialing. We're looking at dental monitoring to be able to be proactive in giving you advice. So at the moment, you would take photographs and say, Jeff, I did A, B, C on this visit. What should I do next visit? With dental monitoring, the patient can take the photographs a few days beforehand. We can download them, and then we can say to you, Doctor, this is what you should be doing the next time the patient comes in. And so we now become far more proactive in our advice. And we're looking at different visual and graphic interfaces to be able to give you advice on what to do at the next visit, to show you visually rather than just typing notes. But this is what I think is one of the most exciting developments. We're looking at introducing a hybrid appliance where we put the braces, the Smilefast braces, maybe for 3 or 4 months, and then finish with aligners. Because as I said to you, the problem with aligner treatment is that it's unpredictable with the difficult movements. So if we can go in with Smilefast braces and do all the difficult extrusions, rotations, etc., and then finish with aligners at the end, only 6 to 8 aligners, this is going to be a game changer as far as I'm concerned. So we're just in the process of trialling that system at the moment. And I'm hoping that come next year, we'll be able to introduce that into the United States as well, because I think that will make it even better as an option for patients and an option for dentists as well. So at the moment, we're looking at a date in early December to come out to the West Coast and provide the 2-day Smilefast course. So just to summarise, Smilefast will provide you with a predictable digital indirect bonding system with one-on-one support and sound orthodontic training. And as far as I understand, we are the only system that does that. And we're going to provide you with comprehensive orthodontic training for short-term orthodontics. So you're going to get the training and clinical support by an orthodontist. We're going to give you a simple, predictable system, a true digital indirect bonding system. There's a minimal initial investment. There's no need to stock a lot of inventory because that comes with each indirect bonding case. And we're going to give you diagnostic hand-holding on every case. So we've gone through that. You can speak to space maintainers once we finalise the core states, which will be, as I said, early December this year, is where we're expecting to be in Los Angeles. And I'm sure that space maintainers will give you guys a special offer for those who've attended this webinar. And once again, you can liaise with Space Maintainer Laboratory, who will be in charge of everything in bringing us out to the United States in December. Our next webinar is going to focus on the business side of incorporating orthodontics into your practice. So today was more on the clinical side of Smilefast. It may scare you what you're missing out on just with your own existing patients, not to mention driving more patients into your practice, more income and more profit. If it's just capturing the existing patients and not seeing them leave your practice to go to another practice who does orthodontics or to go off to the specialist orthodontics. So in other words, you can capture so much more just within your practice. So on that note, I know I've been about 50 minutes. It's been a pleasure to speak to you, to everybody in the United States, and I'm happy to open up for any questions that you may have.
Thank you so very much, Doctor. At this point, I'm going to unmute the line, and anybody with questions, please let us know.